High blood pressure is a dangerous condition that can damage your heart. It affects 1 in 3 people in the United States and 1 billion people worldwide. If left uncontrolled, high blood pressure raises your risk of heart disease and stroke. But there's good news. There are a number of things you can do to lower your blood pressure naturally, even without medication. Here are 6 ways to lower blood pressure naturally. 1. Enjoy regular physical activity. Physical activities, especially aerobic activity, is highly effective in reducing blood pressure. Aerobic exercise forces blood vessels to expand and contract, keeping them flexible. It also increases blood flow and encourages the creation of new blood vessels, among other benefits. During 150 minutes of aerobic activity a week can lower blood pressure, 5 to 8 mmHg. 2. Eat less salt. Cutting your salt intake is probably the most important way to lower your blood pressure. Studies have shown that a low-sodium diet has the same effects as 1.5 to 2 blood pressure medications. The average American consumes 3,500 mg of sodium a day. Far more than the American Heart Association recommendation of no more than 1,500 mg, or about 1 teaspoon of salt. At minimum we recommend lowering sodium intake by at least 1,000 mg per day. If you have hypertension, limiting sodium to 1,500 mg a day should drop your blood pressure by 5 or 6 mmHg. 3. Consume more potassium. A diet high in fast foods, processed foods, carbohydrates, potatoes, and meat is likely to be low in potassium, contributing to high blood pressure. A daily intake of 3,000 to 3,500 mg of potassium through foods such as bananas, tomatoes, and other vegetables is recommended. If you have significant kidney disease, you should be careful not to consume too much potassium because your kidneys may not be able to eliminate it. If you have hypertension, increasing potassium intake to recommended levels should drop your blood pressure 4 to 5 mmHg. 4. Adopt the DASH diet. The dietary approaches to stop hypertension, DASH, diet was created specifically to lower blood pressure. It emphasizes fruits, vegetables, whole grains, and low-fat dietary. People who adopt the DASH diet usually meet low sodium and high potassium guidelines and may lose weight as well. Research on this diet is so positive that it is now considered one of the most important non-pharmaceutical measures for controlling hypertension. The DASH diet can drop systolic pressure up to 11 mmHg. 5. Lose weight. Excess weight increases the likelihood of developing high blood pressure. More than half of US adults are overweight. Losing any amount of weight is a good thing. Every loss of 2.2 pounds should result in a drop of 1 mmHg in blood pressure. 6. Relieve stress. Everybody has some stress in their lives. But prolonged stress can raise your blood pressure and keep it higher, longer than is healthy. One way to relax your mind, body, and blood pressure: practice yoga. Thanks for watching. If this video was helpful to you, give it a thumbs up, subscribe, and share.